I do want to welcome everybody to the webinar. It's how to build a thriving orthobiologic practice in the age of COVID-19. Before we get started, I wanted to mention a couple of things quickly. First of all, Zoom presents in two windows if you're on a desktop. We'll be starting off by sharing some slides. And so if you want to minimize the presenter window so you can see the content, that might be helpful. There's also two other windows, a Q&A window as well as a chat window. Q&A for questions and answers, chats if you are having any issues maybe with connectivity, et cetera, that we can try to help you with. The presentation itself will last about a half hour. And we're going to let it keep going. We'll let you know when the half hour ends. We're going to let it keep going. We are recording the presentation. So if you can't stay for the whole thing, no worries. We'll have it all recorded. We'll have it up on the doctor.com website as well as our website at P3. I want to thank everybody who's on the panel. We have Jessica Nickchey. She is the General Manager of Emerging Markets at doctor.com.
Hello, everybody.
Here we go. We got Dr. Jay Bowen, who is a board-certified physical medicine and pain management specialist at New Jersey Regenerative Institute.
Hello.
And then we've got Dr. Scott Sigman. He is an orthopedic surgeon. He is the Chief Medical Officer for Orthopedic Laser Centers and the host of the Ortho Show podcast. So, and an excellent one that is. I am Scott Zeitzer, and I'm the president of P3 Practice Marketing. We should be taking a look at marketing regenerative medicine practices amid COVID-19. At least that's what I hope you guys are seeing. And I'm going to jump into that. Jess will follow up with a presentation, and then we're just going to open it up to questions. I believe that I'm going to stick with Dr. Scott Sigman's classic line of levity and brevity is best. There we go. All right. So my part of the conversation is really, let me just get rid of that there. My part of the conversation is about how to get patients to your practice. We focus on pipeline rebuilding, patient pipeline rebuilding. In the age of COVID, it's really about getting back to the basics. You need to let your existing and prospective patients know that you're good at what you do, you're experienced at what you do, and that you care about them. So content marketing is really about providing truly relevant and useful information to your prospective and current patients to help them understand how you can help. So I think it's critical when you come up with content marketing, when you discuss content marketing, it's really about getting very specific and very clearly explaining what your practice provides, what they can expect, how you're good at it, how you can help them. It's very critical that you're very specific in those things. And the same thing goes with COVID. I think as restrictions are lifted, potentially put back in place, patients will be concerned about their safety and protecting themselves. And your content can help ease those fears by clearly spelling out what you're doing to protect your patients during this time. And because we're dealing with the new normal, your content can also explain what that new normal is. If you have processes in place, telemedicine, which I know Jessica will be talking about, and available treatment options as well. The clients with whom we have worked with and who have been proactive about content marketing are bouncing back more quickly now that search activity is starting to increase. And our clients are detailing their COVID response. I think it's very critical. One of the key things I want everyone to take out of this particular presentation that I'm providing is that Google is making an effort to index practice websites with COVID details. So a lot of you may have a website and you might have just put something on there like, hey, we know there's COVID and we're following CDC guidelines. I don't think that that's enough. Having a separate page that lists the specifics, everything from how much hand sanitizer you have to whether or not you're allowing patients to be waiting in the car rather than in the waiting room. Google is making an effort to index those practice website pages with COVID details. So it will help you in more ways than one. Email marketing is definitely something that can help can help your patients, sorry, can help update your patients about what's going on with the practice with all the latest developments and changes. It'll create opportunities to, I think what's critical here when it comes to email marketing is don't spam them. Create opportunities to collect patient information, whether that's in your office as part of the intake process, whether that's online, social media, et cetera. I think it's critical you get their information. And as I mentioned, don't spam your patients with email. You got to aim to provide content that is useful. I'm sure a lot of you are at home watching and seeing a lot of ads. And the key thing is be very specific with your emails. Don't spam them with like, we care about you during COVID. Maybe not, don't use the subject line, our response to COVID-19. Again, be more specific. If there's a change in what's going on in the practice, let people know. If you've got some specific comments or help, again, very, very helpful to get that information out to them. And we are seeing that a lot of patients are seeing that as a very positive thing. When you're sending out information via email, try to discuss your available treatment options, but focus on the conditions rather than the procedures. Patients are more likely to be familiar with the condition rather than the treatment. So when you get them to go to the website or get them on the phone, that's when you can get more detailed with treatment options. So that goes back to that content marketing part we talked about before, where you're providing a lot of details about potential treatment options. If you've done your job right with the email marketing, that'll fall in place very well. If they're on the phone and your staff is well trained, again, that will help. Providing some at-home tips. Again, remember, you're trying to be helpful. You're trying to build trust. And so information like exercises and diets can certainly be very important. And I've said this over and over again, but as changes develop, email is another excellent way to let people know about that. So we've talked a little bit and very quickly, because I want to leave enough time for talking, but questions. So we talked about content marketing, we talked about email, and then there's online advertising. And it's something that my caveat with online advertising is this. I do think online advertising is a good thing to do. I also think that you've got to keep your focus on return on investment here. That's a critical thing. Online ads can help you get in front of potential new patients. Search volumes right now are very low right now, and so the pricing is actually better. I think there was a previous conversation about what you can say on your website and how Google is heavily restricting advertising for regenerative medicine, but Facebook ads can work quite well. Facebook ads are also not dependent on search activity, and so they can be very helpful in terms of getting in front of a larger audience and just build, quote, brand awareness. And that's a fancy way of saying awareness about you and your practice. Again, the content marketing that we talked about first, if you're doing a good job of online advertising and you're doing a good job of email marketing, connecting them to those specific pages where you're going more in depth and convincing them that you are, again, good at what you do, experienced at what you do, and that you care about them, it'll really improve your return on investment in your ad spend. I think that's a very critical takeaway. I went through this very, very quickly because I do want to have enough time to speak, and I do want you guys to have questions. I'm going to hand it over now to Jessica Nikci. She is, again, the General Manager of Emerging Markets at Doctor.com, and she is going to talk a bit about how telemedicine is helping regenerative medicine practice.
Great. I'm excited to share some information. As soon as, let me just share my screen.
I think I just stopped there. Go ahead.
Okay. Got it. Perfect. Okay. Fantastic. All right. So how to build a thriving orthobiologic practice in the age of COVID-19. So really excited to chat with everyone today. I know we've all been through a lot of the last few months. And I know the really the coronavirus has been the impetus for physician adoption of telemedicine. It did disrupt a lot of practices across the country. A lot of us were not prepared to have this sort of virtual experience with our patients, and figuring out different ways we could diversify our practice and different ways that we offer both virtual and physical care. But the reality is that we have to find a solution, because from talking to different physicians across the country, there are a lot out there who hate telemedicine, and they never asked for this sort of headache. We have some who have implemented it in the past and have had success, so it was really easy for them to adopt to it. We have some folks who had no clue what they were doing, but they were winging it, and it turned out to be, somewhat successful. And then I have some folks who are absolutely crushing it. So when you find a way to implement telemedicine and figure out what process makes the most sense for your practice, it could be a win-win for you. And I know a lot has changed. A lot of practices are reopening. Yesterday I heard that some of the telemedicine visits for a lot of folks out there have decreased. But then with that, we don't really know what's going to happen in the future. And according to the news, we're likely to have a recurrence again in the fall. And God forbid something like this happens in the next few years, right? We obviously want to be more prepared. So I'd like to go over some best practices that we've discussed, and best practices that we've experienced over the past few months. In terms of housekeeping, you want to deliver a great experience, not only for yourself while you're offering these telemedicine visits, but for your patients as well. So I recommend getting an HD webcam, using a quality microphone headset. Lighting is super important. Having a quiet room, obviously with neutral light. And also a big factor here is ensuring that your internet connection has fast upload speeds as well as fast download speeds. This is typically, fiber connections like Fios or cable will work, because the last thing you want is to have issues with your patient hopping onto that telemedicine visit, and you want to try to eliminate any of that additional time it takes to have them actually start the visit with you. Outside of that, you also want to make sure that you do have a stable plan in place to leverage telemedicine as much as you can now. And then again, if you have a reoccurrence in the fall or telemedicine visits increase again later on, you have a plan of action in place that both your staff and your patients are used to. I think one of the biggest issues is when this all happened, everybody was scrapping, trying to find the first possible platform, Zoom, Doxy, Google Duo. We were just grabbing whatever was available because a lot of states relaxed some of the laws. So it was kind of like a free-for-all. The issue there is that once these regulations lift, now you have to either start paying for those platforms that may not have been ideal for the patient experience anyway. But worst case of all, now you have to retrain staff and patients to use a new platform. We conducted a survey on adoption of telemedicine, and that was really the biggest impediment to adopting it, was having to download, upload, or learn how to use a new system. So 71% of patients are opening to using telemedicine. Obviously, COVID was the catalyst for this, but we've seen that practices can leverage both and increase their net growth. Usage is more than 200% in the past 10 years. So it's pretty prevalent that telemedicine is going to continue to be here to stay for the long term. And 83% of patients are likely to use telemedicine after COVID. From the physician perspective, we want to figure out, obviously, how do we enable net positive revenue flow through telemedicine? How do we use it as a tool, just like everything else at our practice? So some great examples of how you can utilize telemedicine is as a screening tool for your patients before they come in for their visit, building your pipeline with follow-up telemedicine appointments. So if you have patients who maybe made an appointment, but for some reason never followed up with a procedure, those are great folks to follow up with, and then also educate so that you can end up getting them to convert now or later in the year. Use it as a second opinion tool for remote referrals, and it's a great cancellation filler. and obviously it's time saving for everybody. So doctor.com, we actually launched our first virtual visit platform. It's totally free. And what's great is that you actually don't need to download anything, memorize any passwords. We actually did a lot of beta testing with patients who were over 80 years old. And the idea is that we wanted to make something obviously insanely simple for everyone to use and mitigate some of the issues that we've seen with patients hopping on the call and the quality of the call. And our feature is HIPAA compliant, it's HD, and we just launched a review request. So at the end of every virtual visit, you get to ask the patient for a review. And it's really important to use this time to continue to get reviews, spread the word about your 5-star, telemedicine experience, or the experience or procedure success rate from other patients as well. And if you ask patients to leave a review, they will. Over 70% of patients will do so. If you automate reviews by sending a text or email without asking them, your conversion rate is less than 10%. Reviews are going to be important with or without telemedicine. This is just a time that if you do have additional time or additional downtime, that you're utilizing that to sort of change some of the behaviors in your practice that will help your bottom line. And empower patients to talk about the procedures that they've had with you. You obviously want to avoid maybe mentioning this on your website, as Dr. Bowen mentioned earlier, but third-party sites are game on for all reviews, and this is where patients go. So it's definitely something you want to get advantage of, and being transparent with your appointment hours, virtual visit options. Any site a patient finds you on search, it should be easy to book an appointment, request one, and understand how to leverage care with their physician. You want to show the human side of your practice now and later on. Any safety protocols that you have, you definitely want to advertise that. There's still a whole lot of fear out there, and we just want to find different creative ways to engage with your patients. I love that Scott mentioned email marketing. That's awesome. You could do patient webinars. If you have an Instagram or Facebook, you can go live now. This is the time to really show your candor and your personality and engage with patients, and also educate them so that they know exactly why you would be the best physician for them over any other competitor or alternative treatment that's out there. So yeah, tying it all together, telemedicine, reviews, online scheduling, listings, and enhancing the patient experience is really the formula that we've seen that has been helpful for practices who have been able to thrive during these unprecedented times.
Wow. Thank you, Jess.
Thank you.
So we've got already one question in, which was, how do you invite patients to doctor.com's telemed visit? Before I've got a few questions for the docs.
Sure, that's a great question. So basically what you're gonna do is send them a text, and they, upon receiving it, they'll click on the link, and then they end up in your waiting room, and then you join them in your virtual waiting room.
Pretty straightforward. Maybe I'll ask the first question to Dr. Sigman. So how long have you been seeing patients post, like now that we're, I guess, in our COVID planet, and what has the reaction been like?
Yeah, we're about 5 to 6 weeks in at this point, and we've actually also started operating at this time as well, which is great news for the patients that have been on hold for their care. And we're using a real hybrid process. And we use the telemedicine specifically to engage patients, find out initial details, what's happening. And then through that process, we can then arrange for actual appointments in the office, and then minimize their spacing, minimize their time in the office as well. So that way, I think going forward, long-term telemedicine is here to play. It's supposed to be ending in mid-July, but I think they're going to delay that. And I think all of us are going to be, just like with electronic medical records, seemed very difficult when we first started with it, but we're all very used to it now. I think it's going to be a really wonderful way in which we communicate with our patients.
Dr. Bowen, I'll ask you the same question. How long have you been seeing patients, and what's it been like?
So we've never actually shut down, and we're in New Jersey. So most of the cases in New Jersey really were from the transplants commuting from work into New York. But we also have a subcomponent of our populace that's chronic pain patients, and so they really wouldn't be able to go without their medicines. We've had various executive orders from our governor, as every other state's been unique. So we've had some essential services we've provided for those people during that time. We've started to do more elective type procedures as the state allows. And really, ultimately as physicians and going into medicine, you want to care for your patient. And so even though we may have some personal and professional differences with masks and whatever else it is, we try to go the extra mile to make sure that the patient's informed about what we're doing and that they see what we're doing, and that some of the stuff was already happening, right? Universal precautions are there to protect the healthcare provider as well as the patient. And so we cleaned our office. And as my wife said, gee, everybody learned how to clean things now. So, we've always cleaned well and washed hands and done all the things. Now we just publicize those. Again, we have patients, I would say 80 to 90% of patients are very comfortable with our office, and probably because they've been with us, they understand us. But there are some very nervous people, and we always review that you can wait in your car. We can text you when you're ready. We generally only have one person at a time in the waiting room because we try to quickly get them to get into their waiting or in the examining room so that everybody's sort of social distanced, as the new word in the 21st century is. And everybody gets their temperatures taken as they walk into the door. So there's a lot. We've always been a high touch, low volume practice. So where some, practices need to see 100 patients a day, and now with the spacing, it's been very problematic for them how they're going to get that throughput. We have pretty much maintained what we're doing. We had less hours, closed earlier. We'll be opening soon for full-time hours as our volumes have increased. So I think we're in a unique situation, being cash-based mostly, but still taking insurance. Will telemedicine be here to stay? I think a lot of that depends on who's paying for it. If people don't pay for it, it's not going to happen. And if insurers still pay for it, I'm a little nervous about how much it gets adopted in, say, our particular area. Because, if this is a mainly consultative practice on how health and wellness goes, fine over the phone. If you're talking about a procedure, fine, or a follow-up. But when you're trying to make a diagnosis or see someone, I get a little nervous about my colleagues not actually physically evaluating someone. And I've had this experience with regenerative medicine in other states or far traveling, where I say, well, I think it's your shoulder and I think we're going to do this, but it could be from your neck, could be from something else that's going on. And unless I physically evaluate you and see you, I sort of always pause on what we're going to finally do until I put my hands on you. And that's, unfortunately, we are taught in med school to treat the patient, not the image, treat the patient, not the lab test. And because of the way insurance logistics have been, we've been pushed into doing medicine probably in a subpar, quote unquote, efficient manner.
Yeah, let me interject one thing very quickly, and it's more of just process cleanup here. It's a friendly reminder that we're approaching the 30-minute mark, and the next presentation, I'm reading, guys, sorry, is Product Theater, 10 Strategies to Increase Your Bottom Line with Plymouth Medical. Anybody who would like to jump off to that, that's great. Don't worry about it. We're going to keep asking. We've got a few questions up here, and I want to ask the docs those questions. I've got some questions. I know Jess does. We're going to keep recording, and we're going to have links to everyone that signed up. We'll shoot you out a link and let you know where that recording is. So no worries if you want to jump off of this and watch this later. I did want to ask, I wanted to follow up, Dr. Sigman, you talked a lot about from a process perspective, like, hey man, let me get a lot of the stuff out of the way that I would have done, say, in the office, and then get to the physical examination. And we did have someone who asked, and Dr. Bowen, it's interesting that you brought up, like, how do you do a physical exam over telemedicine? And it said, how can we take physical examination in telemedicine virtually? And I think the answer to that is you probably can't, but I wouldn't mind some feedback from both of you.
So, I'll take that quickly because there's some interesting technology coming out with AI and with actually, if you think about how you can get your suit customized. So you can just put your camera down, it can measure you, and it's pretty amazing. And I think we're going to see some really quick advancements in some of these technologies. We've already seen it with Limber, a colleague of mine did for physical therapy exercises. So we're going to be able to have people potentially in front of a camera, especially if you have certain quality, which most of our smartphones will do. Stand on one leg, do a single leg squat. We may get better information than in the office. We may be able to calibrate and say there's a 23-degree valgus of the knee. We may be able to have them stand and flex. We might not be able to get strength scores, but I think it's going to be very interesting. What kind of things, the necessities of mother of invention.
There you go.
So it's there's a lot of this technology just hanging out, and in part because nobody pays for it and they can't figure out how to get it paid for. So just think back to what everybody's seen now advertised, where you can do an EKG with your 2 fingers on this little plate that talks to your phone. The problem is no one paid for it until you have consumer demand, direct to consumer. No one knew how to use it. And I think that's where we're going to start to see some of this evolution, which will push virtual care even further.
Yeah, Dr. Sigman, what do you think? And thank you, Dr. Bowen.
I think in the orthopedic world and the surgical world in particular, I think that the telemedicine and the physical aspect is very good in the post-operative setting. Just as we're talking about AI, we can determine how patients have walked, how many steps they've taken, what their range of motion is. But really, perioperatively or preoperatively, when you're trying to decide and make a clinical diagnosis, if you're going to have an ACL tear, I need to examine the knee to be able to determine what ligaments are involved, what aren't. Rotator cuff tears, for example, I'm going to need to know about your weakness. So I think the physical examination and actual doctor visits are absolutely here to stay. We're not going to be able to do all this from our backyard and our porches from home, if you'd like. But I do think a hybrid model will be absolutely what we see going forwards, especially in the insurance world.
Yeah, I couldn't agree more. And I was just thinking, like, how the heck would you do a drawer test remotely? I don't think that's going to happen for an ACL issue. Jess, do you have some questions that you wanted to ask some of the docs?
Yeah, I did. And I know some people might be hopping off. So one question I have for both of you that I'd love to hear your feedback on is if there, potentially is a reoccurrence in the future, what would you guys do differently, knowing what you know now, if this happened again?
Yeah, so we're very fortunate. We haven't had a single employee, develop COVID. We're in Massachusetts. This is one of the most hard-hit states in the country, as is New Jersey as well. We did precautions early on, and we, sort of monitor our waiting room process, and we've done well. We've installed plexiglass at this point. I would definitely invest in plexiglass companies right now if you already haven't. And so we're putting everything in place that we're going to roll with this thing long term. And if people get sick again, we're already ready to rock and roll, and we'll continue with telemedicine. We're operating in a COVID-free surgery center, which is awesome. So we're testing people as they roll in. Hopefully, we're going to have a vaccine coming out in the first quarter that might actually be practical. Maybe getting some antibody testing so we can identify the patients that have already had it, as well as your employees. So, and then we're probably also going to have to give up a little bit of our what's the word I'm looking for, but our independence. But in other words, surveillance is going to be important. We need to identify patients that have COVID. We need to isolate them, quarantine them, so the rest of us continue to move around in space, maintain our economy, and continue to be able to help heal our patients.
So as usual, you can ask my wife, I have a contrarian view on a lot of these things. I think we've, unfortunately, with lots of things in medicine, we pretty much let the politicians take over the scientific portion of medicine and dictate care. We have 40 to 50,000 people on average every year that die of influenza, and nobody really says anything about it. We have multiple other sources of morbidity, mortality that is just marginalized. And now we're shutting down economies and worlds for this thing called COVID. I think that, I was definitely in agreement in the beginning to say, hey, we need to slow this thing down a little bit to make sure that our healthcare system is prepared for it and then reopen up, because herd immunity, whatever else you're going to say, and to figure out how we're going to treat this is going to be different. Our staff has all undergone testing, and we have antibody testing. No one's had it or been exposed, which we thought was like, does the test actually work? So we tested a few known people. They all had positive antibodies. So we're like, oh, good test. So that's something we would continue to probably do. Also, we stayed open, I think, in part because I do some alternative treatments. I feel on the regenerative side, the healthier the individual is, the more they're going to respond to the care I give. And so I've been doing IV systemic ozone for years. We've added in glutathione and high-dose vitamin C. So we do that to all of our staff that if they feel comfortable and they want to do it, it's for free for them. So we want to keep those people, and I went into medicine to say, I don't care. I want to treat the HIV, the Ebola, the COVID patients. That's why I went into medicine. And so I want my staff to feel comfortable and secure that we have their back as employers and as a provider. But ultimately, I want to service patients. So we have to mitigate things to a certain degree. I agree, but we also shouldn't panic. We should do this with better science. On a side note, same thing. I mean, I think we're going to have a lot more problems because there's definitely going to be another wave. Is it COVID because we've all sequestered ourselves for 3 months and our immune systems are weak and someone sneezes on you with, influenza B and you're dead? I think that, it's a pretty profound statement I just made, right? But I think we're going to see a lot of PTSD. We're going to see a lot of other health and wellness problems in the next 6 months. And it's all related to this, sequestering everybody for 3 months. We know with 9/11, people were fine, but all these things come out 6 to 9 months later. And so we're going to see this huge wave of health and wellness problems related to COVID in the last 3 months.
Just, are you, Dr. Sigman, are you doing any type of online advertising at all? I know you've got Ortho Laser as well as your own practice. So if it's a two-part answer, and Dr. Bowen, I'll be following up with you too. Like, are you reaching out, online for that type of marketing?
It's the most important thing you could possibly do right now. I mean, how else are you going to message? So I always talk about, what's your brand? What's your professional brand? What is it that you want people to know about you as well as your clinical practice? And then what's your message? What do you want to say to people? And now, most importantly, how do you get that message out?
Yeah.
And before, it's super easy. People are at the grocery store, they're here, they're there, they're all talking to each other. Oh, you got to go here, you got to go there. And then you got to go see Dr. Sigman because of all the wonderful things he's doing at Ortho Laser. That's not happening right now. So you have to be a little bit more subtle in how you're generating your message. One of the things that I found to be quite helpful, especially within the LinkedIn ecosystem, is that I'm actually writing articles about laser specifically to try and educate doctors, patients, etc., about what it is that is the technology, how we're using it, for example, what's our success rate and the things that we're doing, and even talking about the basic science to be able to really help people understand. And it's subtle. It's not an absolute direct marketing tool, but yet it helps to generate conversation and discussion. And yes, at this point, we have now restarted our Google ads at this point as well, and we're getting very good response to that. But I think that your content marketing comment is really super important. Your message, who you are, what your brand is, and that's how you're going to get it out right now, because they're not just talking about it in church.
Yeah, I really do think it is about building trust, whether that's through advertising, through telemedicine, where you are building trust, you're interacting, and those reviews are important, where people are saying, yes, you're doing that. Dr. Bowen, what about you? Like, what are you doing from a marketing perspective?
Yeah, to piggyback off a little bit about what Dr. Sigman said is that, patients aren't really out there in the community talking right now.
Yeah.
And so, people would say, oh, you're not in my insurance, or, you're too far. I think they're starting to go, you know what, there's value than just the bottom line. And so if I hear from my friend on LinkedIn or what other, online presence, this doctor is, reached out to the community and said, this is what they're doing. It's a very safe environment. That person is going to rise to the top. And we have our email list of our past electronic medical record patients to reach out and just say, we're here for you. We are open. Because we had patients that sort of toward the end had waited long enough and they were like, I need to get in. And didn't really know that we were open the entire time. And they're like, I would have came a month ago if I'd have known, but I assumed you were closed. So just the fact of saying we're open, these are our hours, whether that's on, whatever platform it is. And then to say, as Dr. Sigman said, educate them. These are the very specific things we are doing. And you can either come in, or we also are open to telehealth. We're also open to you calling, and our staff can allay your very specific fear. And then we usually do a monthly seminar in person to just do a review of what we do. And so that now is going to move to a webinar kind of status where we can educate people and potentially engage people at a higher volume with sort of more throughput. And, now that it's virtual sort of the norm, I think that's going to help a lot versus, those guys are doing it virtually versus, okay, I'm willing to sign up and listen.
That's very interesting, that quote, new norm. I think we're all getting used to these conversations online. Jess, I know you've got a question too.
Yeah, absolutely. So just in terms of communicating with your patients, do you guys send push notifications, text messages to them and update them that way? Just curious.
So the push notifications that we're doing are really associated with the reviews. We're not necessarily push notifying them with additional information. And I will say this, Jess, you know, I'm not a paid sponsor for Doctor.com, but I am a user of Doctor.com, both for my clinical practice as well as ortho laser. And it has really been an exceptionally valuable tool to be able to get these patients who genuinely want to give you a review. But the process of getting the review has been the problem of actually doing so. And, you know, one bad review sets you back for such a long time. So really having people to generally want to talk and say good things about you, especially in this social media world, has really helped a lot.
Mm-hmm. Absolutely. Thank you. I appreciate that. Yeah, and I know it's really challenging. Dr. Patel asked earlier, like, how do you get patients to leave positive reviews? So it's nice to have a platform like ours that automates this across the sites, but it really boils down to like the behaviors that you can improve within the practice, how you can get your staff to do it, because it all becomes an operational, you know, process for the practice, and implementation is only going to be as effective as the process, right? So I'm happy to hear that. And the reason why I initially asked about the notifications, and actually, Dr. Bowen, do you send push notifications for like practice updates or anything for your practice, or have you during COVID-19?
So we'll be doing email sort of notifications in the future. I'm very sensitive, I guess, on the personal side, is I don't want to, as Scott had said earlier, to spam or inundate these people. So as we sit down as a group and a practice to try to decide what is the right message, what is the right volume, what is the right time frame, because I don't want to just have it every time they see me delete, and then I don't even want to go to that doctor anymore. So I feel the same way as an individual. So the first thing I run through is my filter, and I'm like, if this would bother me, then we're not doing it.
Mm-hmm.
Yeah.
So I think it's that definite balance that everybody has to keep looking at on maybe a monthly and annual basis is, are what we doing as a practice too much or too little? And I think that doing more variety is probably better than doing more of one thing. And so I think if you're out, the more platforms you're on, the more ways you can do things, whether it's reviews or letting them know about you. I think that's a little bit better. Because as someone searches you out and they see the same message on 5 different platforms, it's not like you messaging the same thing on 5 times.
Yeah, you know, one thing I think I want to just interject something, Jess, regarding email, online marketing, your website. Measuring is so critical. So, you know, if you're going to email, don't just blindly email people. If you're going to do advertising, same thing. Measure what's going on. So you can actually utilize email marketing services that will measure how many people open a particular email, how many people respond to a particular email. Same thing with online advertising, how effective they are, where they're going. There are ways to program the back end of your website that will keep track of all that. We use and pushdoctor.com as well. I guess that's why we're on this call together. And a lot of our back end is connected so that we can keep track of what's going on from where. And help connect the dots. But that's what that's about. Guys, the overarching is, if anyone's listening to this, is you need to build trust. Dr. Sigman and Dr. Bowen are both talking about, like, how do I just tell people, like, goodness gracious, I want to take care of you. I'm pretty good at this. Why don't you come by? You know, I mean, it's an oversimplification, but the best way to get the word out, it really depends on your personality. It depends on where you are, but measure, please, everybody. That's your big key to take away. I know I'm the biomedical engineer, but measure.
But I think that's key, because as a business person, right, you listen, we're happy to spend money on marketing or getting a patient in, but I don't want to throw it out the window.
Right.
Mm-hmm. Totally. And I asked you guys about the push notification because I had an experience. So my primary care physician, they never texted me like ever in my life. So I get a text message from them that they're now offering telemedicine. So I took advantage of it, and I had a 7-minute visit, got a prescription. I wasn't even expecting to like be able to do that. It was awesome. And I, took 7 minutes versus like an hour and a half. So loved that. And then weeks later, I got a push notification that they're now offering antibody tests. So I was one of the first of my friends, family members in my community that had an antibody test. So from that one push notification that I got, had the test results within that week. And it was an amazing experience for me. And if I had not done that, it would have been like everyone else trying to Google, like, where do I go for the antibodies? So in terms of like, what could we do better in the future and how could we improve this sort of communication? I think it's so important using those push notifications or emails, obviously not inundating your patients, but being strategic. So I think that was really great because the turnaround was wonderful. And then Dr. Bowen, with what you're doing with ozone therapy and like the preventative measure aspects, it's interesting to think about how you can kind of like utilize your marketing to prepare your patients for what might happen and start raising awareness on what you're doing so they can maintain their health. Because as you mentioned, like, we don't know what's going to really happen in 3 to 6 months and what adverse effects people are going to experience.
Yeah, that becomes an issue that, you know, non-medical people have pushed me to try to advertise. And we have to be very careful as we started this off a little bit, dovetailing for me looking at our last TOBI lecture about what do you put out there on regenerative medicine for advertising and quote stem cells to not get yourself in trouble with FTC, FDA, et cetera. And unfortunately, you know, the government is got its own, I guess, agenda for whatever reason. We could always debate that at some other point. But I have colleagues that have had their licenses temporarily revoked for giving vitamin C for a viral infection. And they didn't say specifically they cured COVID. They said they treated viral infections. So yeah, it'd be nice to put some of this stuff out there and work on patients' health and wellness. But we're unfortunately in a disease management model in the United States that is going to benefit pharmaceuticals and other players. And something we are trying to, with a group of individuals, trying to reinvent the wheel. And every aspect of healthcare, we're trying to look at what is it and defining it. So first of all, what is health? Second of all, how do you care for health and maximize it? 2, what is disease? 3, how do you advertise it? 4, how do you pay for it? My partner and I were talking, and it was simple as, oh, we'll take cash. I'm like, well, that's the easy answer. Let's take a step back and see, is that actually just falling into the same old pattern, or is that actually revolutionary? And this is the time where we can have revolutionary medicine, as we talked in the beginning, right? We're starting with virtual care, maybe virtual visits, maybe virtual exams. Where will the technology lead? I think there are going to be certain players that it's going to go against their financial interests, and we're going to be up against it. Same way as the government decided to close us all down, whether it was based in science or not. So it's going to be an interesting future.
Yeah, guys, we're getting close to 20 minutes over. And so I just kind of wanted to finish. Like, Dr. Sigman, do you have any thoughts that you want people to go away with? Are you okay? I want to point out, though, that for when you talk about building a brand and follow the fro for Scott, he actually works out of his closet when he is doing his podcast because it's quieter there. How many boys do you have, Scott?
5 boys and a dog. So I think, the messaging is important. I think your personal message, for me, I actually write all of my own social media posts from beginning to end. And that may not be possible for everyone that's in the process. So, there are scribes and there are people that can help you, that are, consultants in the industry that can sort of make a difference, and as Scott and P3 does. So, you don't have to be out there on your own. And I do think that the social media platforms and the online places and all the technology is out there is wonderful. So if you don't know how to do it, ask for help. And there's some great people around to do so.
Yeah. And wait, on that point, Dr. Sigman, just because your platform is so awesome, like, in terms of a patient sentiment about you and their perception, I should say, their perception of you, do you get more patients from your social media outlets, or is it more word of mouth? Like, what's like the biggest, if there was like one common theme that you could pinpoint, what would it be?
I think it's the entire sort of internet process. It's so, it's through the website, it's through my videos, it's through the people that follow me on my podcast, it's the people that follow me through social media, and then it's also the spread of word of mouth. I mean, just yesterday I operated on 3 patients that all drove an hour and a half to come and see me for their surgery. So it's the whole shtick, it's the whole package, it's the entire brand. You need to hit across all airwaves.
High five, virtual high five. That was the best answer.
That's about where we're at right now with the virtual high five. Dr. Bowen, do you have any things that you want people to take away, or similar sentiment, or
Yeah, I think I would echo what everybody said is that this is a new age. You have to think new. It's been a new age even since I started out in medicine, right? So it used to be when I went into training 20 years or more ago, you hang up a shingle, you had a good reputation, everybody came to see you, you did good care. I got to New Jersey, I called it Goomba medicine because it was more what could you do for me and I could do for you and refer back and forth. I'm like, that is not why I went into medicine. And we fast forward to now we're virtual. But I think it's across all platforms, from word of mouth all the way to this new burgeoning technology.
Yeah, excellent. Jess, do you have any thoughts before we shut it down?
No, I think like a lot of people are trying to diversify their practice, but they're not thinking about how the internet perceives them. And I think it's just really important to realize that you want to be ubiquitous in the way you're reaching out to patients. A lot of people are like, oh, it has to be either Google or Healthgrades, right? Or I'm either an orthopedic surgeon or a regenerative medicine doctor. I can't, people, are forgetting that they could actually be both and do a lot of different things and then do them really well. And I think that just keeping that in mind, diversifying yourself and trying to attract patients from all different types of, all different walks of life, to patients that you want to attract specifically as well.
Yeah, guys, if anyone's listening to this, my takeaway would be try to put yourself in your patient's shoes. And when I first speak to a doctor about their practice, I always beg them to call their office. And I don't mean the private line to their office manager. I mean the office. And if there's 14 buttons to choose and you're on the phone for 20 minutes, gives you a good indication where you need to start. Protect, when you talk about marketing, it's about protecting your brand and protecting who you are and what you're about. You took a Hippocratic oath, or the oath of Maimonides, or whatever the newer one is. And that's about doing no harm to patients, which of course I think all of you all are going to do. But I do think from a big term picture, positioning yourself so that you're letting people know what you do, what you're good at, and trying to align and trying to get those specific patients. That's a critical. Guys, I want to thank everybody. We're almost at the hour mark. We're looks like about 20 minutes over, 25 minutes over. Everything is going to be recorded. I think we're going to stop recording now, and thank you very much.